All right, good afternoon, everybody. I'm very happy to be here with you today, though I'm not that happy to be standing between you and cocktail hour. So thank you for choosing to be here with the sun shining in here. I just wanted to start by thanking Sarah and Pranay and our notable squad over here for putting together such a great meeting so far. I'm really happy to be here. My name is Allison Collins. I'm the Vice President of Digital Strategy at Catholic Health on Long Island. I've spent my entire career in healthcare focused on digital strategy and patient engagement, and I've worked at several health systems across the country, including 8 years at NYU Langone Health in New York City, where I led a digital transformation alongside Michael Monero, who is now the Chief Digital Information Officer at Catholic Health. And he unfortunately was not able to be here today with me, so I'll be sharing a few stories from both of us. To give you a little bit of context about Catholic Health, compared to health systems in the rest of the country, we're probably about medium sized, but I would say on Long Island, we are fairly small. We have about 16,000 employees, including 2,800 physicians. We have 6 hospitals. We have more than 100 doctor's offices with about almost 24 ambulatory care locations with multiple specialties there. We also have a very large home care and a hospice. Just to show you the environment that we are competing in, the yellow stars here on Long Island represent our 6 hospitals. And in many cases, we have direct competitors right across the street or around the corner. So we are surrounded by giants like NYU Langone, New York Presbyterian, Northwell. The competition is incredibly fierce for patients on Long Island. So we really need to up the game when we are putting together a patient engagement strategy. Sorry. Before I get into our digital strategy and journey at Catholic Health, I wanted to tell a personal story. I am what I would call a frequent flyer in the New York City healthcare system. I have several chronic conditions, and I actually had a stroke 9 months ago. So thank you for bearing with me as I look at my notes today. Still not 100%. All of my health systems use Epic, thankfully, which means that I get to basically live inside my chart. So I'm constantly in my chart, really multiple times a day, looking at what my next appointment is, looking at my test results, doing billing. But I never have time to think about a primary care visit, to think about a mammogram, to think about those regular screenings that I need to have to keep me healthy. It is this experience that I take into putting together a patient engagement strategy at a hospital, because I know if we can solve for those most complex patients who are in the office a lot and who need to be reminded of their care regularly, then we can solve for those patients who are only in the office about once a year. When I got to Catholic Health last year, it was about 6 months after Mike had started as CDIO. And he wooed me from Memorial Sloan Kettering Cancer Center, where I was at the time, by telling me that I could build a digital strategy team at Catholic Health. There was not a single employee devoted to digital before I started. He was the first CDIO at Catholic Health. And so when I came over, there was a huge opportunity. He told me, though, we had come from big software development shops where we were building everything ourselves. And he told me we were going to do things a little bit differently at Catholic Health. We were going to buy, not build. And so he told me that there were a lot of vendors circling him. He said it was like bringing a sandwich to the beach on Long Island. Everybody was circling, trying to get his business. He did his initial assessment of the state of digital at Catholic Health, and it was bleak, as you can see. We had Epic installed, but there was not a lot of optimization that had been done. My chart was not optimized. We did not have a patient portal app. We had a very limited number of cell phone numbers and emails on file for our patients. In fact, we only had about 25% of emails for our patients at the time. So even if we wanted to do digital engagement with them, we couldn't, because we didn't have their contact information. We also had limited ability for patients to schedule online. And as everybody here knows, you can spend millions of dollars on a patient engagement platform, but if you don't have online scheduling, you're not going to get very far. Given this competitive market, we really could not afford to spend all of our time catching up. We had to be able to innovate at the same time that we were putting a lot of these foundations in place. And this was a really tall order for me, obviously, because I was the only person on the digital strategy team. But the good news was that I had the support of our CEO and our CDIO. And so we began on our journey. We sat with the CEO and put together this digital vision, which was to provide the most consistently seamless and trusted patient-centric experience on Long Island, exceeding the expectations of all of our audiences. And it is that exceeding, which I would say is the most important word here. We couldn't just be good enough in this competitive environment. We needed to surprise and delight. We needed to be able to innovate. We needed to feel like that trusted partner that a patient with a chronic illness needs. We then had to look at how we were going to do that. And as we look at digital engagement across the system, I define that as the touch points that a patient has across their entire journey with us. So that could start with Google search. It can continue with our website, with email, with text messaging, with the patient portal. These were all the ways we were going to be in a person's life to help keep them healthy throughout their journey. So from this vision, we developed a set of digital engagement principles to guide us along the way. First, we wanted to deliver technology with the consumer benefits of those brands that our patients are used to interacting with on a daily basis, like an Amazon. But the key difference here is that we really wanted to preserve the warmth of that provider-patient relationship, and we wanted patients to feel like they were having that one-on-one engagement with us. We wanted to support them as a critical member, the most critical member of the care team. We wanted to empower them to take ownership of their health and have access to their health information 24/7 whenever they wanted to get it. And we wanted to reflect the Catholic Health brand in all of our touch points. What I didn't mention previously is that Catholic Health is actually a new brand. So we've been on Long Island for a very long time, but about 3 years before I started, Catholic Health became our new brand. And there were people who had spent their entire lives on Long Island, and they were used to hearing St. Francis Hospital or Good Samaritan Hospital, and they had never heard of Catholic Health. So our engagement was going to be a really important point for us to educate patients about who our new brand was. And then, of course, we want to remain top of mind when a person isn't physically in our care, but when they need care, when their loved one needs care, we want them to think about coming to Catholic Health. Like many other leading healthcare providers, we use Epic and MyChart, as I mentioned. As I also mentioned, this was not in a good state when I arrived. But we did decide that we wanted to put MyChart at the center of our patient engagement. We wanted all roads to lead to MyChart because we knew the patient was going to have to go there to see when their upcoming appointment was, to check their test results, to pay their bill. So we spent the past year optimizing MyChart. We started with the branding. So you can see here, obviously this looks like our colors. We have our logo here. That was work that wasn't done previously. We also launched the Catholic Health app in January of this year. And in August of this year, we became the 6th medical center in the country to launch Hello World, which is Epic's new texting platform. So that's been really exciting for us. We've made a lot of improvements to MyChart this past year. But during this process, while we knew that Epic and MyChart were going to be at the core, we also knew that Epic was not going to be able to deliver everything we needed in terms of our patient engagement strategy. They have a very packed roadmap. They're not going to move as quickly as we needed them to move. So we wanted to make sure that we could build a relationship with another trusted partner who was going to be able to innovate quickly with us. When we started meeting with different vendors, we wanted to make sure that they would be able to innovate at that rapid pace that we needed. As I mentioned, Mike and I came from this really big software development company in NYU. We had built custom radiology scheduling. We built custom text messaging. So we were used to that level of customization, and we needed to find that in another vendor. But now, instead of hiring people to do that, we were having to pick that vendor relationship. Mike loves to tell the story that when he met Pranay for the first time, he really did not want to like him. He came out of that meeting, though, and said, you know what? Notable is doing everything right. They have a solid DevOps pipeline. They have solid user experience design, and that's how Notable became our partner about a year ago. I've worked with a lot of vendors over the years, and I find that the best vendor relationships are those where it feels like a true partnership and we're working alongside each other as teams. And now, yes, I do have a team. I have 2 more people on my team. But we need to be working toward the same goals together. We're looking for a vendor who's very nimble and who will work with us very closely. And that's what we've found with Notable. We started out with Notable focused on their care gap outreach tool. And we had a lot of different care gaps that we were looking at, beginning with mammography, colonoscopy, diabetic eye screening, but we really couldn't do that. There was just no way that we could start there, or it would take us a very long time because, as I said, we did not have that online scheduling available yet. So we decided to begin with the Medicare annual wellness visit, where we knew we could pretty easily standardize our provider schedules across internal medicine and primary care. We knew that that visit also, though, would be a critical first step to closing additional care gaps along the way. So it wasn't just going to be that one single visit. In that visit, they would order a mammogram or a colonoscopy, and then in the coming months, additional care gaps would be closed. Oh, I'm sorry. So this is a quick animation of what we're doing in the tool, but I'm going to show you each of our different screens on the next slide. So for the patient, it is as easy as getting that email or text message, clicking on a link, validating their last name and date of birth, and then immediately they're seeing the available times and locations for their Medicare attributed provider. They click on that link and the appointment is directly scheduled into Epic. From there, we pick up with our Epic messaging. So the patient is getting their appointment reminder, their test results from the Epic messaging. As I mentioned, we connected Notable to Epic, so that appointment is directly scheduled into Epic. You can see here that Notable AWV outreach patient scheduled online is actually the scheduler that is in Epic for that appointment. So our staff is aware that that appointment was scheduled through Notable. And we've also set up automated feeds to Notable of our patients that are due and coming due for an annual wellness visit on a weekly basis. So on a Tuesday, we'll send out our emails and text messages to the patients who are due. And then 6 days later, we'll follow up again if they haven't yet scheduled. And then 90 days later, we'll follow up again a third time if they haven't scheduled yet. The scheduling looks like our website. It's simple, it's easy to use, and it's directly connected to Epic. So it's been fitting perfectly into our digital experience. As you can see here, we've received so much positive feedback from our patients. They say it's simple, it's fast, it's convenient. I love that your office reached out to me. We began in February with a proof of concept for a handful really of medical practices. We wanted to show everybody that this was going to work, and it worked so well that we were able to scale, and now we have 60 internal medicine providers live on scheduling with Notable. And we are reaching all Medicare patients who have an attributed provider that has their schedule available. We've been really happy with the results with Notable. 50% of patients who we've engaged with are scheduling that annual wellness visit, and we've had 600 AWVs scheduled so far. So if conservatively we estimate that each of those appointments is worth $100, we've collected about $60,000, saved $60,000. And we are also working with our data team to ensure that we can start to measure all of those additional care gaps that I talked about before that we're closing downstream, so we can actually really show the value of this tool as a whole. So what are we able to collect within 90 days of that appointment related to the care gap closures? We've had a 99% patient satisfaction rate, so our patients are also very happy with this tool. How are we going to continue to move forward and continue to iterate and improve on this tool? Well, the first step was us working with Notable to develop this dashboard for our annual wellness visits. Thank you. So on this dashboard, we can see in real time our engagement rate, our conversion rate. We can see the funnel and where we have patients dropping off within this flow. We can see in real time the feedback from our patients. So if there's anything we need to address, we can either reach out to the practice, we can reach out to the patient. We can see individual providers and how well they're converting. And in many of those cases, we've been able to improve the collection of cell phone and emails for providers as well. So we've been very happy with this dashboard. We really use this as our tool on a regular basis to make sure that we're able to optimize these efforts. What are our lessons learned and how are we going to move forward? The first is A/B testing, which is very important to us. So in the beginning, we actually did an A/B test right out of the gate to determine whether a 6-day follow-up or a 2-day follow-up with our patients was more effective. And 6 days slightly edged out the 2 days. So we're doing that 6-day follow-up now. But our next step is to look at the copy of our messaging, because what we've seen is that there is some drop off between a patient that's receiving a message and the patients that are clicking into that messaging. So we're currently working on an A/B test with different subject lines for the emails, different copy for the email and text messages to look at where we can improve. As we talked about before, scheduling optimization is incredibly important. So we need to continue to work with our practices to optimize their schedules in order to open up for additional internal medicine providers, but also to expand to other care gaps. We found during this process that as our providers were adapting to COVID, let me say, they started doing things like annual wellness visits over the phone, video visits. They would tell a patient that they had a visit on a particular day, but the patient didn't really know the time. So they were having to wait around for a phone call from the nurse, from the provider. This obviously is not a great flow. So we've been able to use Notable to identify this as a gap on our side and look at how we can improve that process and improve the scheduling standardization. We've also been strengthening our collaborations with our operations teams. The two teams that we work most closely together with are our medical group that oversees all of our employed practices, and then our quality team. And in many cases, they are calling individual patients to let them know that they're due for these care gaps. But unfortunately, when they're on the phone with these patients, they're not actually scheduling the appointment. They're either transferring the patient to the office to schedule the appointment, or they're just saying, you need to schedule this appointment, call us back when it's convenient for you. So obviously we know that many of these care gaps are not getting scheduled. Unfortunately, these groups were also very hesitant to collaborate with us in the beginning when we were working with Notable. They said, we don't know if this tool is going to work. We don't really want to figure out how we can work together to close these care gaps. You do your thing, we'll do our thing, and we'll come together later, maybe. Fortunately, they do want to come together now, because a few weeks ago we showed them our results and they said, you know what, let's actually start working together now. And later this year and next year, let's come up with a plan where we can first reach out to a patient digitally, and then we can follow up with a phone call as needed. So this is what we were trying to achieve from the beginning, and we're happy that everybody has come around to this idea. We also need to make sure that we're engaging the front desk staff. Unfortunately, also, when we launched Notable, we saw that a few, Daniel's shaking his head. We saw that front desk staff were canceling appointments that were scheduled through Notable because we reached out to them and said, what are you doing? Like, we just had these patients schedule appointments digitally. And they said, no, that patient's not due for an annual wellness visit. They have an annual physical scheduled, or they just had an annual wellness visit, 9 months ago. So they didn't understand the rules for these patients that were due either in a calendar year or every 365 days. They didn't understand. We did educate them on what the Notable visit was, but they really just didn't understand the rules for these types of appointments. So we've used this as a re-education opportunity to let them know that we are aware that these patients are due for an annual wellness visit. And in many cases, they should be canceling the annual physical that was scheduled. We also need the front desk staff and our registration staff to collect accurate contact information. This sounds so basic, but there is a big resistance at Catholic Health to doing this. We have had to go so far as to building a hard stop into Epic. So the front desk staff has to ask a patient if they have their cell phone or if they have their email address and it's accurate, or they have to give us a reason why they can't collect that information because it's been so hard to get. So we have seen a huge improvement in that area as well. We've also asked ourselves where we can go from here and how we can continue to expand our use of the care gap closure tool. So we have plans to expand to commercial insurance patients who are due for annual physicals in the coming months, and this will open us up to a big population. As many of you, I'm sure, see the same thing. We've had a lot of patients who are not coming in for 2 or 3 years during COVID, so it's really time to bring these patients back in the office. We also want to make sure that we can start to look at other screening care gaps like mammograms and colonoscopies. These have also been a sticking point for us because of operations, because the practices need to figure out whether they want us to have these screening exams ordered by the primary care doctor. Should a mammogram be ordered by a GYN? Who's going to do that follow-up? Should there be a gastroenterologist involved for the colonoscopies? And then also we've identified that there's some issues with the health maintenance being marked as completed in Epic. So we could be reaching out to patients who had already had the screening exam. So we are going to work closely with Notable and possibly on chart scrubbing to see how we can just determine that we're doing outreach to patients who need it most effectively. As Sarah scooped me in the earlier session, I also am excited to let you know that we are partnering with Notable on implementing the assistant on our website, chisley.org. And we expect to have that live in the coming weeks. We expect to be the first health system in the New York area to do that. When I was at NYU and at Sloan Kettering, we built these massive websites, and we spent so much time building information architectures, doing user experience design. But you could do the best user experience design for one persona, and then a patient is going to navigate the website in a completely different way. So you can really never please everyone. But now we have these large language models and AI that can really understand a user's intent and the context of which they're searching, and then draw from the website to give them answers to those questions. So this has been a really big shift, I think, in user experience, where we can focus on making sure that all the right content exists, and then the assistant can help give the patient the answers they need in the tone and voice that's the same as if the patient was picking up the phone to call. Do you want to bring up the video? This has really been a game changer and something that Mike and I have dreamed about for many years, and it's finally becoming a reality through the assistant. Mike loves to say that the assistant is like your mother-in-law. She points out all your flaws. And so we are going to spend several weeks taking a look at our content. And I can say this because I don't oversee content on our website, but our content is a problem. I know we can't answer all the questions that are going to be asked. So for example, this is what the answer to what are the visiting hours looks like. The reality here, which you can't really tell this, but I know this, we have a page with visiting hours for each of the 6 of our hospitals, and the assistant has picked up the visiting hours for the first hospital on that page. So a patient would read these visiting hours and think that they found the right answer to their question, but in fact, they just got the visiting hours for the wrong hospital. So we are going to be spending some time working in Flow Studio and uploading the right content for the right answer to this question. And the reality is we could do 2 things. We could update our website content to make it clear that the visiting hours vary based on the hospital, or we could let the assistant know that they need to ask a patient which hospital's visiting hours they're looking for first before they can really answer that question. So once we publish the new content to Flow Studio, you can see here that there is a new answer that makes it very clear that visiting hours vary by hospital and department. And then you can see here an updated link to the visitor policy on the website, or you can ask a follow-up question, letting the assistant know which hospital you're looking for. So we will be spending the next few weeks updating our content on the website and making sure that we're ready to launch. This has been a labor of love with our marketing team as well, because they have not wanted to launch the assistant. So I've convinced them that we are only going to put it on one page on our website. We're going to put it on the homepage, and we're going to see how it performs. And I am going to be neurotically checking how people are using the assistant and making sure that we can respond to any content updates that are needed, just to make sure we can get our marketing team on board. So the next step for the assistant will be to look at single sign-on with MyChart, because we know that some of our patients will continue to go to MyChart and do what they need to do in MyChart because they know they have their account and they're familiar with taking that route. But there's other patients who are going to come to our website and want to reschedule, cancel an appointment. They're going to want to refill a prescription from our website. And that's something, if you were in the demo lounge, you have seen that that is something that's going to be possible with Assistant. And we're very excited about that. So ultimately, we're going to continue to work with Notable to meet patients where they are and give them the right information at the right time and in the right channel. And I'm really grateful that we have Notable as such a nimble partner working with us throughout this process. So thank you very much, and I'm happy to answer any questions.
Hi, Rosemary Bonilla from St. John's Episcopal Hospital, Far Rockaway, Queens. Close to you, but not that close.
I used to live in Queens.
Oh, okay. I'm a Brooklyn girl, so
Okay,
anyway.
all right. Well, I also lived in Brooklyn.
Yeah,
So.
good. So my question is, so with marketing now giving you that little bit of resistance, did they come up with other platforms that they wanted to utilize for this feature? Because there's nothing else out there, correct?
No.
Correct. Yeah. All right. So that's a good way to just shut them down. Okay, good. I didn't know what else to say.
I think so I actually come from marketing.
Okay.
This is the first time I've worked in IT, so I do have some sympathy for them. They have a very small team, and I would say because of that, they do have a resistance to change. And to them, this tool looked like more content work to do.
Right.
So I've actually, because I have a content background, because my senior director has a content background, we've both promised that we will help with content as needed to sort of alleviate that burden. If I were still at NYU Langone, we could put the assistant on that website tomorrow, and I would be confident that that would perform extremely well. Unfortunately, we have some work to do on our website content, so this is going to help us do that work as well, and I think will help illuminate some of the challenges that we're having.
Right. We're rebranding. We're doing the website over, so we're in the same, what you went through, the same thing. It's just I didn't know how to make sure to tell them there's nothing else out there. But now that I know there isn't, I guess I could use that. Thank you.
Yeah.
Question about the MyChart app and then also patients scheduling their wellness check via Notable. Did you notice that it's different patient type that are using the Notable ability to schedule appointments versus going directly into the My Health Online or the MyChart app?
We really haven't been able to see any differences. We were actually not reminding patients that they were due through MyChart anyway, so we don't have anything to compare the patient group to. I would just say that we continue to need to collect the right email and cell phone so we can reach all patients. And I think if we had better contact information, we would be able to do that comparison between a MyChart active patient and a patient that's not active in MyChart. So we're trying to increase that across the board, but no, we haven't really been able to look closely at that yet.
Hey, I'm Mike Hancock. I work for Castell, the Intermountain Healthcare Population Health Company. We're on this journey too with Daniel, working to get care gap scheduling up and running. I just wanted to check. So we're trying to get a sense of some realistic expectations for the responsiveness. And so I go back to your slide that I think it said 50% of people. What was that? 50% of people that you reached out to via text.
The tool. So it's people who've engaged with the tool. So the people who are logging in, 50% of people are scheduling.
Okay, so the text is sent, they hit the link, they go into it, that's engaged, and then 50% of those people actually schedule. Okay.
Yep.
Do you have a sense of all of the people who you sent a text to? What percent of that?
about 10% of those patients. It does vary based on provider. It varies based on whether the patient is overdue. So we see a lower conversion if the patient is overdue.
Mm-hmm.
Possibly that patient did close the care gap somewhere else. They might have had their annual wellness visit somewhere else. We only reach out to patients that have been in our system in the past 2 years. They've come to Catholic Health for an appointment in the past 2 years. That's what we consider to be our active patients. So the patients who are overdue, like I said, they could have gone somewhere else in the past 2 years. We have a much higher conversion rate for those patients who are coming due, and we're reaching out 30 to 60 days before the patient is due for that appointment. And we only open up the appointment slots after we know that they're due. So essentially, like they'll come in 30 to 60 days before, but they won't see availability until 30 to 60 days
okay,
out.
got it. And then did you say you send the first text and then 6 days later you send a second one? And then is that all?
Doing. Then 90 days later, we're sending another message. So
then
this would be where ideally our quality team is coming in and calling the patient and trying to close the care gap. And if they can't close it that way, then again, we're following up via Notable.
Okay. Thank you.
Yeah.
My name is John Scott. I'm at the University of Washington in Seattle, and my question's around health equity. I'm just wondering if you have any like KPIs or metrics where you're kind of looking at the deployment of this new tool and whether it's worsening that digital divide or helping. I mean, it seems like having one fewer like login and things like that, and some of the other languages that are available, that this might actually help. I'm just wondering if that was kind of on your performance indicators.
It's not something that we're able to see directly. I would say this is, a great way for us, as you said, to use another tool that a patient doesn't have to log into, and we know their birth date and they know their last name, and they can be using that to log in. So no, we don't have specific data on that, but obviously that's something that we can definitely look at moving forward. Yes.
I speak now. I don't. So you had said in the beginning of your presentation about your emails that 20%, you only had 20% of email addresses for your patients, right? Is that what you had?
25%.
25.
Yeah.
So has that changed now?
Yes. Yeah.
So what is the new percent?
So we're up to about 42% of emails and 70% of cell phones.
Great.
So there's been a huge improvement. We've trained our front desk staff again. Like I said, we also we're using e-check-in through MyChart. We're asking patients to validate their contact information again. We're putting up notifications through MyChart, asking patients to give us their contact information. So we're trying from every angle to keep increasing that. But that's actually one of our biggest initiatives, in addition to encouraging patients to create a MyChart account as well. All right. Thank you so much, everybody.